Hi everyone, my name is Abhijit Minhas. I'm a physiotherapist with a bachelor's in physiotherapy, a master's in exercise science, a keen interest in sports injuries and their management. And in this video series, I'm going to basically go over some of the most common injuries seen in your favorite athletes and try to simplify that. So stick around. So in this video, we are going to talk about some common cricket injuries. Now, I've already made two videos on Ravindra Jadeja and Jasprit Bumrah's cricket injuries, but in this video, I wanted to do something different. Now that we have the World Cup happening this year in India, I wanted to take a second to discuss some of the injuries that are plaguing Team India right now. What are some of the athletes? Who are some of the athletes who are out? What are their particular problems? And what can we expect in their recovery process? The next cricketer on the list is Navdeep Sani. So Navdeep Sani is a right arm fast bowler who recently sustained an abdominal strain. Now, Navdeep Sani has already kind of recovered from the abdominal strain and he's back already playing, which is evident from his performance that we saw, and even on his Instagram, you could see that he's back playing the sport. But I just wanted to take a quick second to discuss what an abdominal strain is, since that also is very common among fast bowlers, fielders, all-rounders, etc. So an abdominal strain is either an overuse or an overstretch injury of the abdominal muscles, which are basically present right around the front part of the torso. Now, we primarily have four abdominal muscles. Starting from deep to shallow, we have the transverse abdominis, which is the true core of the body, which wraps all the visceral abdominal contents in the torso. Then over that lies the internal and the external oblique muscles, which are these oblique muscles running on the side of the body, and their main action, like for the transverse abdominis, is to hold and brace everything. For the internal and the external obliques is side movements, rotations, things like that. When both the oblique muscles contract together, we can also have a little bit of forward bending with that. And finally, the most superficial muscle in the abdominal wall or the abdominal musculature is the rectus abdominis, or the classic six-pack, right in front, two rows of the six-pack muscles right in front of. And the main action of these muscles is the bending forward of the torso. So oftentimes we get injuries of abdominal muscles often as overstretched injuries, where consider a hyperextended position where we are trying to lean backward. Think the position of when somebody is bowling and then they try to reach back. So they're trying to stretch their abdominal contents, where they're going into what we in medical community call as extension, which is stretching. And then from a stretch position, suddenly with the rotation, generating enough force or contraction in the muscles. So the muscles go from a stretch position to a quick contraction position, which can often lead to an abdominal strain. So the classic signs and symptoms of abdominal strain can present as pain along the abdomen, tenderness along the abdomen, swelling, discoloration, inability to move the torso, as in bend forward, backward, do side to side motions, and oftentimes even difficulty with laughing, sneezing, breathing, things of that nature. Abdominal strains can be divided primarily into three broad categories, just like other muscular strains. So the first category of abdominal strain is a mild strain, like a first degree strain, which is caused by overstretching. So once again, think about a diving catch, reaching out, bowling, where your arm goes back and your back is really bending that way and you're stretching the front part of the torso, and that would be the first degree, where there's a overstretch or a strain in the muscles. Second degree abdominal strain is where some of the muscles of the obliques or the rectus or the transverse abdominis may have partial rupture in their muscle fibers. So some muscles are intact, but some of them are now ruptured. And finally, the last one, or the third degree, is a full rupture, which really requires a really severe force. Mostly happens in these sporting events where there's an overstretching and then huge sudden contraction of muscles, fast movements, rotations, things like that, where there's a complete rupture of the muscle from from its attachment. Depending on what category of abdominal strain a person or an athlete may have, we can have different signs and symptoms from mild pain, like we discussed earlier, to severe pain, difficulty to move at all, also feeling of nausea, vomiting, athletes feeling pale, unable to get up or stand straight, things of that nature. There is also a side category of abdominal strains, which is called as just side strains, which primarily include the internal obliques, the external obliques, and the transverse abdominis, which is the deeper core muscle. Now, we often find that these muscles are injured or strained in their attachments to the ribs. So if you look at the positioning of the abdominal muscles, they tend to start from our pelvis, which would be right around here, and then they start to drive up towards the rib cage. We don't often find a lot of incidents of abdominal strains of the muscle close to the pelvis, but we do tend to find a lot of abdominal strains closer to the last few rib attachments. Treatment options are always a combination of rest, pain medications to relieve the pain, the swelling, taking some time off from the sports, and then when the initial symptoms start to calm down, we start to incorporate some exercise as a primary mode of intervention to treat this problem. Exercises can start from anywhere where we can just start with some general activities, right, in the rest period, like encourage our patients to walk, encourage our athletes to just go for some simple walking, which does not really tax the torso too much. As the symptoms in the next couple of weeks start to get better, we start to challenge our athletes and especially those core muscles with some exercises which do not involve a lot of movement in the core, but creation of tension in the core, like planks, dead bugs, etc. Now, severity of this will depend on the symptoms. So we'll start with easy exercises, of course, and slowly start to make it more advanced. So the dead bug, the planks would be more advanced exercises. Some very simple contractions, standing and pushing on ball, on pushing on the wall and stuff like that would be easier exercises. So that brings us to the end of Navdeep Sani and his abdominal strain. We are very glad that he's already back to playing, and hopefully we should see him play for Rajasthan Royals, but more than that for Team India real soon. Next on our list of injured players is Deepak Chahar. And unfortunately, oh boy, for this right arm medium bowler, he's had his string of injuries, and I really feel bad for him. And the latest set of injuries that he's faced is a hamstring strain that has kept him out of the next couple of series. Now, Deepak Chahar plays for the Indian national cricket team and for the Chennai Super Kings, and recently, while he was out bowling, he injured he's supposed to bowl for 10 overs, and by his third over, he had started to slow down, and we saw that he was really limping and he could not finish his designated 10 overs. Now, he did come back to bat again, but he did not look the same. And after the game was over, we knew that he had sustained a hamstring strain. So let's break down a hamstring strain. So what exactly is a hamstring strain? For that, we first have to understand what is the hamstring muscle. So the hamstring muscle is a group of 3 muscles which are present at the back part of our leg, right around here. And the main action of a hamstring muscles is to basically bend the knee and bring the leg behind at the hip. Now, the primary action of it is to actually bend the knee, and the secondary action is to bring that hip behind the body. The hamstring muscles have a common origin. They start from what we call as the ischial tuberosity, or it's part of the sit bone at the pelvis, and then from here, as you can see in the image, it kind of runs down in the inside of the thigh, that is the semitendinosus and the semimembranosus, and goes and inserts in the inside part of the knee. And on the outside part of the knee, we have the bicep femoris, which in medical terms we call as the lateral hamstring. Hamstring strains are not uncommon. In fact, they are very common injuries sustained in different kinds of sports. Oftentimes they are contraction injuries, but mostly they are overstretch injuries of the hamstring muscle. They are roughly divided into 3 stages. We have, just like any other muscle strain, we have the grade 1 strain, which is a partial strain of the muscles of the hamstring. Grade 2 would be a step further than a regular strain, where there is partial rupture of some of the muscle fibers. If it's a high hamstring strain, it is closer to the hip. If it's the middle part of the hamstring, then of course it's the mid-thigh area where you'll see that injury. And the third one would be a grade 3 or a severe strain where the muscle can actually completely tear off from the bone and retract back a little bit. Often common signs and symptoms of hamstring strains or ruptures are pain along the back part of the thigh, tenderness, inability to stretch the leg out or bring the leg forward since those muscle is already strained, some bruising, discoloration, increase in like some temperature or just the muscle feeling hot are some of the common signs, and of course difficulty to generate force through the hamstring are some of the common signs that a person may have experienced a hamstring strain. Now, if some of our athletes have a grade 1 or a grade 2 strain, we can use our physical examination to try and figure out whether this could be grade 1 or 2 or 3. In a grade 1 or 2, oftentimes there will be pain with some movements in the muscle, but our athletes may be able to perform that movement, which is bending the knee. However, in a full tear, it may be extremely difficult for the patient to do any bending at the knee or at the hip, and even walking a few steps may feel really difficult. Along with that, in a full rupture, there would be some major discoloration and bruising. We often see that with bodybuilders when they have that. There's a lot of swelling and bluish discoloration that can almost trickle down the leg. And we can also get a lumpy feeling in the hamstring, which tells us that the hamstring has actually ripped from one of the areas and almost kind of come together and clumped into this bunch. So that can happen as well. In this case, I think Deepak Chahar, we don't have a lot of information, but it doesn't look like he's had a full rupture, because remember that he bowled 3 overs, but then he came back to bat again, just an indication that this could be most likely a grade 1 or a grade 2. But given the professional nature of sports, we need to give all our athletes enough time to address these issues, and that's why he was pulled. So again, my hunch is that he had a grade 1 or a grade 2 hamstring strain. How is this managed? So it's managed again conservatively with using medications, rest, ice, exercise, etc. Surgery is not a preferred treatment option, at least in grade 1 and 2, and sometimes in grade 3 maybe a surgery is required, but oftentimes these kind of injuries, unless they are very severe, are managed conservatively with medication, physiotherapy, etc. Broadly speaking, just like abdominal strains, the hamstring strains also have similar grading, so the concept or the principle of rehabilitation in terms of physiotherapy kind of remains the same. The first part is active rest and recovery, where we are trying to minimize any excessive movement. We are getting that area enough time to rest. So things that you may often find in a physiotherapy office like ultrasound machines, neuromuscular tense machines, ice packs, massages may help decrease the tension in the muscle. Along with that, anti-inflammatory medications can be used to decrease the inflammation. When these things start to subside, then we slowly start to add some active recovery things, something that does not put too much stress on the legs. So things like swimming could be done, easy exercise like elliptical, maybe getting on an easy bike with no resistance can be initial steps into recovery. From there we can move on to maybe just walking, slowly going to jog walks and stuff like that. So those would be the initial rehab gateway into exercise, and then from there on we can start to do some isometrics, just like in the abdominal rehab that we discussed. Isometrics means there is no movement actually happening in the muscle, so it's not like you're doing hamstring curls in the gym where you're bending and where you're on your stomach and you're bending your legs. Rather, you're just trying to generate some tension and force in the hamstring muscle. And from here, as the muscle starts to get better and as time passes, we can now start to explore certain other options like more challenging, progressively challenging exercises like hamstring curls, deadlifts, modified deadlifts, Romanian deadlifts, Bulgarian split squats, hamstring curls, I think we already mentioned that, bridge walkouts, etc. So there are a ton of options, and as our athletes start to feel better, we progressively start to make the exercise a bit more challenging. Now finally, in the last one, when a complete hamstring rupture, If we know our athlete has to get back to the highest form of cricket, then most likely surgical repair of the hamstring muscle may be required. In that case, the recovery is not just like any other muscle strain recovery, 4 to 6 weeks roughly, then that can be a bit longer. And again, we give enough time for the surgical site or the muscle to heal, and then we almost follow similar protocol, but we just tend to take the whole process a bit slower as compared to a grade 1 or a grade 2. And finally, we've made it to the last player on the list, and that is, and he's the only player who's not a bowler. So as you could tell, bowlers have a higher chance of injuries in cricket as compared to playing in different other positions. But our last player on the list is Rishabh Panth, and we all know that's not truly a cricketing injury that he sustained. So for those of you who don't know about Rishabh Pant plays for the Indian cricket team, and he's a wicketkeeper. Unfortunately, on 30th December 2022, he was driving from New Delhi to Roorkee to surprise his family, and while he was driving, unfortunately, his car hit a divider and he was in a major car accident in which he sustained many injuries to his right wrist, to his feet, to his legs, to the knees, abrasions on his back, etc., etc. Of all these injuries, he is recovering now. We saw this new post on Instagram where you can see he is now using walkers and canes and other assistive devices to walk, but he is slowly starting to come back. But this is going to be a long rehab process for Rishabh Pant, as we know. In all of his injuries, the biggest one that are of most concern to us are his knee ligament injuries. Now, once again, we don't know what injuries he has sustained, but we've heard that he's basically injured 3 of his primary ligaments in the knee. And my suspicion, when somebody says 3 primary ligaments of the knee, it has to be most likely the ACL, the anterior cruciate ligament. It could be possibly the PCL, the posterior cruciate ligament, or it could be one of the other 2 ligaments, which is the MCL or the LCL. The MCL is the medial collateral ligament, which is on the inside of the knee, and the LCL is the lateral collateral ligament on the outside of the knee. So he most likely has injured a combination of these 2 or 3 ligaments, and unfortunately for this, the recovery time definitely is a long process. He's just had surgery, so most likely he's had an ACL repair or one of those ligaments repair. Now again, we don't know the details of this, but either of these ligaments, when injured, the rehab process is anywhere between 6 to 9 months. And when I say 6, I'm actually not too happy saying that. It ideally should be 9 months and more. So clearly, I don't think he'll be playing the World Cup or any other sports in 2023, but we do hope for a speedy recovery from Rishabh Pant. Since the list of injuries and talking about ACL rehab or PCL rehab or collateral ligament rehab is so long, I would actually make a whole new different video on Rishabh Pant's injuries. So we are going to stop this here right now. But before I let you go, I do want to take a minute to talk about what we can expect. Like I said, Rishabh Pant is not coming back for at least a year, and 9 months of that is just required to heal all of his leg muscles. His leg ligaments after the surgery. Add to that, he has sustained all these other injuries in a car accident. When he recovers from that, there's going to be this long process of getting back into playing shape, getting into peak performance, which may take some more time as well. So I don't think, realistically speaking, we would be seeing Rishabh Pant on the field or on the pitch, unfortunately, for the next year. That is the list of cricketing injuries that India has sustained so far and India is struggling with. Now, hopefully, we'd be able to see some of these players back. But from my experience, I think it might be a bit hard to see Bumrah back for World Cup. It might be hard to see Rishabh Pant back for World Cup. With Krishna, I think he may be able to come back, but it's hard to say. So anyways, that's a list of cricketing injuries which are plaguing Team India right now. If you have your favorite athletes you would like to know about, send me a message, leave a comment here, and we can discuss your sporting injuries of your favorite athletes. So until next time, I'll catch you guys soon. Bye.